Welcome to Healthcare APPtitude, where healthcare's thought leaders will examine ways to address the rising costs of care in America. We'll also examine how the latest advances in mobile apps are helping hospitals and health systems bend the cost curve and improve patient engagement.
Welcome to Healthcare APPtitude. I'm Tom Testa, and joining me is the show's better half, Bruce Kennedy. And Bruce, I'm excited to be back on the air with you. You know, we've had a string of fantastic guests over the years. We kind of come to the end of 2021, and we've got another amazing, outstanding expert lined up for today's show.
Yeah, Tom, I'm really excited about our guest this afternoon. I've had an opportunity to work with Cindy Geoghegan over the past few months and have been always impressed by her insights in the area of patient advocacy. You know, the topic that we're going to cover today really revolves around what do we owe the patient in the mobile health space. And I think there's no better person to talk to about this topic than Cindy. So Cindy is part of the MobileSmith Health Product Advisory Board, and that's the capacity in which I've worked with her in the last few months. So I thank her profusely for joining Product Advisory Board. Cindy, by way of a short bio here, is the founder and principal of Patients and Partners, patient advocate and cancer survivor with decades of health policy, communications, and capacity building experience. Cindy founded Patient and Partners in 2009 as a consulting firm committed to patient-focused outcomes. Patient and Partners provides strategic consulting, health communications, and policy counsel to academic institutions, nonprofit organizations, and healthcare companies that share a common goal, which is accelerating the discovery and delivery of healthcare products and services that improve people's lives. Geoghegan ensures that representative patient perspectives are considered in decision-making, communications, and planning across the healthcare continuum. Welcome, Cindy, to the show. And as I mentioned earlier, folks who are listening, there's another 2 paragraphs of bio for Cindy, but I'm not going to read. It'll be up on the website for the show, certainly. But I could spend the next 15 minutes reading off her accolades. But Cindy, welcome to the show. How are you doing this morning?
I'm doing really well. Thank you, Tom and Bruce, for inviting me. And also thank you, Bruce, for not reading my whole bio. So the only thing that I would add to that is why I became a patient advocate and why I decided to focus on patient-focused outcomes. Unfortunately, or maybe fortunately, because it changed my life in some ways for the better, I was diagnosed with breast cancer 26 years ago. And I was a young person to get breast cancer. I had no lumps, bumps, family history or anything. It just kind of hit me between the eyes. And at the time, I was a corporate communications professional. So I decided, well, and I had 2 little kids at home, if this can happen to me, this can happen to anybody. And they don't know that. So I became, at that point, kind of as I was going through radiation treatment and surgeries, I became a patient advocate. I didn't know what that was at the time, but I started volunteering for what was to become one of the first Susan G. Komen Breast Cancer Foundation affiliate. I was diagnosed and treated in Baltimore, Maryland, where I was living at the time. So the rest, as they say, is kind of history. But what I kind of would like to bring to this conversation today is my perspective as having supported, sat with, written materials for, advocated for probably tens of thousands of patients, mostly in the cancer and oncology space, but also more recently, kind of broadened that to get into things like digital health that we're going to talk about today.
That's very powerful, Cindy. Thank you for sharing that with us and in our audience. I mean, having your perspective and insights here is going to be just so valuable. So thank you again, and just a remarkable story. And the patients certainly have quite the advocate on their side. That said, Cindy, as a staunch patient advocate, which we know you are, you just talked about that and what you've been doing over the last almost 30 years now. What do you think the healthcare industry needs to do to ensure patient perspectives are considered in decision-making, communications, and in planning really across the whole healthcare continuum?
That's a big question. I mean, there's so much wrong with the healthcare system that none of us, like anybody, any patient or any patient advocate, or frankly, any health system can fix on their own. But there are things that really are important. You know, when I speak publicly, I talk about you put patient-centered in front of anything right now as an adjective, and it's very in. Like, so when I started advocating for patients, it was before patient patients really had a seat at the table. Now, fortunately, there's a patient perspective that's kind of attempted to be integrated into different things. But particularly, I think as we move into technology, there's a lot of this, if we build it, they will come. Just the expectation that any technology, any device, any app that was kind of helpful in other venues, if we give it to a patient, they'll just they will come. And what's missing in those is that we don't look at it the same way as we look at other consumer products, is what's in it for us as patients. So some of the things that I've seen are like tracking devices, right? I don't see the value. They're not helping me. They're not providing information. Then there are apps that actually can help me with my health, can share information, can educate me. So I think that providing value to patients and information and help where they need it and when they need it, I think is really, really going to be critical.
Cindy, that is so true. And I kind of had this internal chuckle when you talked about the patient-centered prefix on everything that got put out. Unfortunately, I got started in healthcare in around the early 2000s. So I was part of that patient-centeredness wave of communications that flowed from healthcare. And you're absolutely right. And it's still being done in many cases, which is unfortunate, because it seems as though what you're saying is that while we have focused on patient-centeredness, perhaps, we have not focused on patient prioritization.
Yeah, that's a really good point. It's probably prioritization might even be too strong. Just think about the perspective of the patient, right? So I don't have a tech background, but I just know from, my reading and being involved in business that you always go to the consumer to see what they need before you develop a product. A lot of what happens in medicine and in digital health is there's a technology in search of a use. And whether it enables or helps a patient might not be the case, but you could collect, there's a colleague, I guess, a peer patient advocate. She calls us data cows because there's a lot of apps and things that are just sucking the data from us or sucking our information. They want us to report on different things, but there's not any value kind of derived for the patient themselves. So it's not necessarily that it has to be two-way communications, but things like reminders or education or information or questions to ask, different things like that help the patient. Because you got to understand, in most cases, patients are really stressed out, right? They don't want to be sick, and caregivers as well. They don't want to be sick. They want to get better. They have the same time constraints that other professionals have, not that being a patient is a profession, but in a lot of cases, it's a full-time job and then some. And then you have a family, you have work, you have, all those other things. So things that could make patients' life better and easier, those are the real patient-centric things. It's not that patient centricity is a bad thing. It's a great concept. And, one of the things when I talk to colleagues in the pharma industry and they say they're patient-centric or patient-focused, I ask, what were you before? Your products were for patients. So I guess it shouldn't be rocket science. It's just important to think about the perspective of the user and the context that they're using it, right? They might be in pain. They might be half asleep. They might be medicated, but they're clearly stressed out, like before surgery or before any big procedure. So just to think about what that person and that person's caregiver or family needs. Nobody can calm you down when you're facing, in some cases, a life-threatening illness. But what could make that person's job, because it is a job, easier? People don't want to not take their medicine. They don't want to not appointments. Not only don't they always have the information, in some cases, it's like a challenge to get to it. People don't call you back. You go on a website and the information's not there. And it's like you called the wrong number. And if you could just keep putting yourself in the shoes of the person that you're trying to help or you're trying to reach, it goes a really long way.
Cindy, if there was one disease area or treatment space that this seems to be the biggest challenge, I would say it's probably oncology. When I recall working with oncology programs fresh out of the gate in healthcare, I was presented with the book. And you know what the book is. It's that 3-inch, 3-ring binder of material they give you when you're starting your cancer treatment. It's for you and your family, and it weighs about 40 pounds, and you're supposed to carry it with you everywhere, basically. And people were overwhelmed. And so I remember the attempts being made at making this easier, more accessible to patients. in a digital format was, let's just digitize everything in the book and give it to them in a digital format that's easy for them to access. And that didn't quite cut it. We never really took a look at what we were giving to them and how we were giving it to them. We just focused on the mode of transmission, not the actual content and all those good things that you can do with a mobile environment to make their lives and jobs easier of dealing with their diagnoses. Where did we go wrong in that?
It's not necessarily that we or you went wrong in that. I mean, this is true in oncology, and I know it pretty well. Among things I did was I managed an organization that provided a peer-to-peer hotline 24/7. And I wasn't allowed to answer the phone because I wasn't trained and certified, even though I was the CEO. But we had 150 volunteers who would answer the phone to answer patient questions. The thing I learned so much from that, but one of the things I learned is the need to provide information at the level that the person wants and at the right time, as in any organization, but especially in a nonprofit. I mean, resources are a challenge. So among things we looked at was eliminating the 24/7. But we realized we got most of the calls in the middle of the night because that's when people were scared. They couldn't sleep. And these are things that you can really enable with technology, but they were scared. They couldn't sleep. And frankly, they didn't want anybody else to know, right? So we were an anonymous peer-to-peer hotline. So you call in another cancer survivor to ask a question. I mean, we had MD PhDs calling us because, when somebody gives you some really scary information, you probably don't hear most of it. So we'd have literally medical doctors calling to ask, a breast cancer survivor on the phone, like what certain words meant, or if the doctor could have really said this. So I guess what I'm getting at is providing a big book is given a lot of work and responsibility to the person. But one of the things is we don't all want a lot of information, or we want it when we want it. And I mean, I have family members and close friends who, when they go through health challenges, they behave way differently than I would. A lot of people don't want the information. They don't want to know, just tell me what to do. Other people like me, would not only take your 3-inch binder, I'd go find 3 more because I wanted to read everything, even things that weren't relevant to me. Because that's the other piece about getting a 3-inch binder. Probably 2 3/4 inches of that aren't relevant to the specific person. You're going to read a lot of scary things. You're going to read about potential side effects or potential outcomes that really have nothing to do with you. There's a lot of not just woe is me or in being diagnosed with a bad disease, but there's also a what about me. So what we could do in the digital space with technology is really tailor things for people and make it on demand and more convenient for them, right? So you don't just have to go to a website and read about everybody else until you get to your stuff. You can actually just see stuff that you need.
Cindy, you mentioned, when you were referring to your hotline about bringing resources and information to patients at a time and place of their choosing. And that's something that a lot of those who are trying to be innovative with technologies are trying to do. That's why we're seeing the telehealths and things like that coming to these patients at a time and place of their choosing, when they're comfortable, when they want to address it.
Right.
My question to you is, providers want to help, patients want the ease of help. Where's the disconnect there? Why aren't we seeing some of these solutions being adopted by either the provider or the patient to have those resources available at a time and place of their choosing?
It's all about time and money, really. It's time on the provider, not just because of COVID, but I think the demands on the healthcare providers, physicians, nurses, and the people who help them is just incredible right now. And so being on demand really doesn't kind of play into that. How can you be on demand when you're already overwhelmed?
Right.
On the other side, patients, a lot of clinics and doctors' offices are only open from 9 to 4. So if you have a full-time job and 4 kids at home, how do you kind of access care or information during those hours? So, and then part of it is these resources cost money. So the healthcare systems, can't just keep buying every latest thing and paying more and more staff. And patients really, in a lot of cases, are disadvantaged because they can't even access some of the things that already exist because they're not reimbursed or they're underinsured. So it's really an opportunity. I look on the bright side, but I think it's really an opportunity to refine and find just little tools or little things that could make everybody's life easier. Like some of this technology, I'm involved with the Digital Medicine Society. I'm on the research committee. And so I have this incredible opportunity to hear about all the latest and greatest ways to monitor and take care of people. But do you know how much information and data that's kind of coming out of these devices? Now, I can, wear this fantastic thing on my wrist, and then I bring it to my poor healthcare provider, my primary care physician, and I tell him, look at what I have. And I want to download it, but it's like, who has the time? Who has the time even to download it, let alone interpret it and figure out what it means for me? So I think as we get so excited about technology, we really need to look at the things we can solve at a time. Maybe one day we'll just walk through a scanner and we won't need to have all these people helping us, but we're not there yet. We're not there yet. So we need to kind of not just be respectful, but we really need to honor the time of patients and their families and their caregivers, as well as the people who take care of them.
Cindy, just a quick follow-up to that, because I think you made an amazing point there, and that is the data overloading, right? We're overloading data on the provider side, we're overloading data on the patient side. Has the data or the collection of data itself become a bit of a distraction to the delivery of patient care?
I think so. Again, another thing I've worked with is the Clinical Trials Transformation Initiative, which is a Duke FDA joint effort looking at how to make clinical research more efficient. In those cases, when you're collecting data with a device for a very specific purpose, kind of maybe like an endpoint in a clinical trial or measuring an outcome, in that case, the data is relevant. I think we get too excited as it's sort of like an interpretation of the if you build it, they will come. It's like, if you collect it, it'll be useful. Well, it isn't all useful. And we're all a little bit different. So some of the algorithms, read a lot about artificial intelligence and machine learning. Some of the algorithms didn't have the right people in them or the right data when they were created. So you learn things like Apple Watch might not measure the same on certain colors of skin, or if you have a tattoo, so it's just things where we continue to learn, but we need to kind of go a little more slowly and make sure that everything we're measuring and collecting is useful.
As a kind of nexus to that, one of the other terms, in addition to patient centricity that got thrown around a lot or heavily, was reinventing the patient experience. Have we improved the patient experience over the last 10 years, 15 years?
Being a patient is pretty hellish right now. Think about the last time you even tried to pick up a prescription. It's really awful. So there's so many ways we can make it better. There's a lot of issues related to access, and not just affordability, but availability. And things like technology and telehealth and collecting things electronically at the convenient time for the patient are all great things, but they're all part of a system that's kind of overburdened.
Yeah. It's really unfortunate at a time when patients are really trying to get a seat at the table and take control of their healthcare. We talked about all that data, and now we're having, things like meaningful use and really all that access to their data, right? And patients want that data, and it's unfortunate that things are still so dysfunctional at a time when they're trying to really take hold of their own healthcare.
Well, I think Cindy makes a really excellent point, and and that's why I love her perspective so much, because so much of the technology that I've been involved in, and we've been involved in even as an industry, has been about how do we drive better access and throughput, right? The assumption is if you get better throughput, if you gain more efficiency, you get better throughput, and then you gain better access and can see more patients and help improve care because you're seeing more people. That's kind of the dogma that's followed the industry for a while. And what you find out there quite often, sometimes in the wilderness, are people like Cindy who are really active in, okay, yeah, throughput's great. All that efficiency is great, but how does that impact the patient? Like, what's the patient's perspective of your throughput initiatives and your efficiency initiatives? I could tell you now, it's just not talked about enough. It's like, well, we assume that if we provide more access, that's always a great thing for the patient. And it is, because we can help more people, but we assume everything is fine with our process, and access is the issue, where experience may be the issue. So, Cindy, in terms of patient experience, forget the care for a moment. It sounds as though we really haven't improved the patient experience because of the dysfunction that exists in the entire organism. Is that kind of, you think, where we're at?
Yes, but to go even further, it's not that there's any bad actor in here. Well, there are everywhere, I guess. but there's silos, right? So for the patient or the caregiver, they're hurdle, right? So first you need to make sure that you're getting your care in the place where it will be reimbursed, right? So you try that first. Then you have to make an appointment. Like, let's just take like a little journey, right? So then I have to make an appointment. I need a colonoscopy. So I need to find a place where I can get reimbursed, where they'll take my insurance. I call and I get an appointment 6 months from now. Okay. I mean, let me pull out my decade at a glance so that I can take care of my health. It's like, and by that point, I'm not motivated anymore. They're like, you might want to generously call them speed bumps, but there's hurdles to taking care of yourself and the system the way it is. And it's not just because the insurance companies are bad. In some cases, some of these health systems, but they don't make it easy for people. And we just need to kind of think about that, and then just think about the person, not this being their full-time job, being a patient, right? Like in some cases, some people don't know what their job's going to be 6 months from now, or where they're going to be living, let alone, whether they're going to be free at Tuesday at 6 a.m., 6 months from now. A lot of things became a lot clearer during COVID. The need to be able to reach and communicate with patients when it wasn't really safe and they were being told not to leave their homes to go to their hospital care facility. So that showed that we need technology, and we can use technology, and that technology can really function to help us take care of people. So things like telehealth and information sharing and monitoring patients remotely, the ability to be able to do some of those things to help with convenience, with access, with accessibility, with just accommodating the needs of people and being available to them. That was incredible. But the other thing that we really saw, not just in the incidence and mortality from COVID, but in people's ability to access things like telehealth information, was just these incredible disparities we have in this country. So again, if you're inclined and you can access and you can do it, these are amazing things. But if you don't have broadband, telehealth isn't really going to be helpful to you. If you don't have the latest and greatest cell phone with data that you don't have to pay for, telehealth may not help you either. It's not going to be the same as it is for people that have these things. So social determinants of health really might make more difference sometimes than your healthcare status. But it's like where you live, whether you have the means to access healthcare, diet, your environment, pollution. There's just so many things. The disparities that we have and the inequities that touch on our healthcare system, we really need to look at.
Let's dig into this some more, because I think this is a topic that is sometimes somewhat marginalized in the tech space, because, as a tech company and as tech thinkers, mobile companies look at the proliferation of broadband and mobile phone device use, or mobile device use, right? We go, well, listen, we're now at the say 5% mark in terms of high-speed mobile device use. So therefore, we are automatically going to hit all the populations we couldn't hit 10 years ago or 15 years ago. And you make some really excellent points here, in that mobile may not be able to fully bridge the gap between healthcare and healthcare disparities and underserved and marginalized communities, right? That we have to provide care to, that are seeking care. And I want to talk a bit more about that. I think it's an assumption that we make at our own peril as a society. So from your perspective, is it a concerted surround sound effort that will drive this? Is mobile the driver we think it is what I'm trying to get to?
I like to think about possibilities. I think the possibilities for mobile to be a driver of more accessible, equitable care are real. Yes, but everybody might not have a data plan that they don't pay for, or that they don't share with the rest of their family, or that they need for their work. Like everybody has a cell phone, but when you start, getting into the data, not everybody uses it for health. If we can help enable people by providing the devices, providing the access access to data, and respecting that they might not want to use their own, I think we do have that opportunity. If we just make these generalizations that mobile or technology is going to be the solution without looking at whether everybody really does have access to the internet or access to a cell phone that will be enabled to kind of help the people take care of themselves, then I think we might have something.
Yeah, it's really crazy. I was part of a program many moons ago that looked at putting health kiosks strategically. Remember the health kiosk phase?
Yep.
We were dropping health kiosks all over the place. And you're right, it is a very local endeavor, right? Because you have to connect those kiosks back to. And at that point, that was considered mobile. That was, we're giving people mobile access to their care.
That's
and
right.
then with the proliferation of broadband plans and more mobile device usage, all of the kiosks went away, right? It just became too expensive a model to adopt. And I always thought, well, weren't we supposed to keep the kiosk and also expand mobile device use? And we just never did. And it's just a weird dynamic.
See, and you raise an excellent point, the flexibility part. So some people might want to still go to a kiosk, right? Because it's private, they can focus on their health, they can go set themselves up and do it. Some people might want to do it remotely, but that flexibility of, it's not just choice, but it's the convenience part. Like we talked earlier about the needs of cancer patients. In many cases, if you're a seriously ill cancer patient, you look forward to those in-person doctor visits, and not in a twisted way, because you might be getting some, really toxic chemotherapy, but somebody's going to look you in the eyes and touch you and tell you you're doing okay. Or if the news isn't so great, they'll be able to talk you through it. You're not just reading it on a phone or on a screen. I mean, again, I don't have the data on this, but my experience in supporting patients is seriously ill people still need some semblance of that person-to-person personal care. Again, it's not always the same, but we can't just necessarily make generalizations that everything can be mobile or digital.
No, that's an excellent point, Cindy.
Cindy, how has implementing mobile technology helped, or how can it actually help relieve the burden on providers and their staff? We've seen a lot of this happening with, especially on the nursing side. The burden on nurses has been so powerful that, they've really been leaving the profession kind of in droves, which is really negatively impacting the patient experience and the patient health. So how can it relieve the burden on providers while empowering them with more transparent, accurate, and mobile patient data?
So one of the things we talk about is how technology can provide more convenience and more access for patients. But on the other side, it could also provide or alleviate a lot of the burden on the healthcare team, specifically nurses. So nurses have a special relationship with patients. Patients really trust and value their nurses. I also know, and I've probably maybe admittedly been guilty of this myself, you have a question or you need something, you're going to call the nurse who's already burdened and taking care of probably too many people, especially during times like this. And so you'll call the nurse and say, now, what time is my appointment next Wednesday? Or I know you told me to stop taking this pill, but I forgot when. If mobile technology could provide some of that information where you could direct a person, look at this today or tomorrow you need to, that's going to take a lot of the burden away. Again, it's going to have to be pretty specific to that, that disease or that treatment and that person. And maybe, if you're dealing with an older person who might not have the digital literacy or aptitude, or as well as healthcare literacy, and you might need to share information with their caregiver or the person who's actually going to have to take the time off to drive them to the appointment, that could really help a lot. I mean, I just know if you give somebody a phone number, they're going to call it. I mean, when they need information, they need help, they're going to call. But if you also gave them an app or a website or even a recording to call that would have the information, I know I don't have the data, but I know that would save some burden and time for a nurse.
Cindy, a quick follow-up to that, because I think you make a real substantive connection there that doesn't really get talked about too much. Folks who work in the industry know that the role that nurses play, pivotal it is to the care of patients. They are not just the caregivers and care managers, they're also the care translators, right? They're the ones that are sitting down with you after you're meeting with your physician and going, okay, here's what you really want to do. Or here's the treatment plan moving forward, that kind of thing. And I think we underestimate the relationship that a nurse will have with their patient. We often do that. Is that something that we need to amplify more than we have? I mean, we always look at providers and patients, in our conversations, and we tend to keep the nurse in the background. Do we do that?
Yeah, I think to help nurses and to nurture nurses as a profession and to kind of help with this, this exodus that potentially is coming, I think we need to respect them. I think patients and their caregivers learn pretty quickly that the nurse in this relationship is the one who's going to be helpful. But if you could put some of that information someplace that's in the language that people need, coming from a voice like a nurse at the appropriate time, I think we could help a lot of people.
Cindy, this has been great. I knew having you on would be a great interview and a great conversation, and you have not let us down. So thank you so much for taking the time to join us today. We really enjoyed the conversation and look forward to our continued working together through your work with the MobileSmith Health Product Advisory Board. Thank you, Cindy, so much.
Thank you.
Thank you for listening to another episode of Healthcare Aptitude, sponsored by MobileSmith Health. Be sure to tune in weekdays at 7 a.m., 3 p.m., and 11 p.m. Eastern Time on Healthcare Now Radio.